Hello everyone, this is me, Jancy Mary, tutor working at M College of Nursing. Today we are going to discuss about the topic chest physiotherapy. So objectives: at the end of the session, the listener will be able to understand the importance of chest physiotherapy, its purposes, indications and components. So this is an important nursing procedure used to remove secretions from the lungs and improve breathing. Let's go down on the slides to see what it is. So what is chest physiotherapy? Chest physiotherapy is a group of technique used to clear excessive secretions from the respiratory tract. So it helps patients breathe more easily and prevents the infection. So it is a therapeutic procedure where it improves the ventilation, helps to remove the mucus from the lung and prevents the complications. Moving on to the purpose, it loosens the thick secretions, promotes effective coughing, improves the oxygenation, prevents the atelectasis and reduces the risk infection. So the main purpose is to what? To mobilize the secretions. So when mucus accumulates, it blocks airways, which leads to infection or collapse of lung tissue known as atelectasis. So to prevent atelectasis, it is very important to give chest physiotherapy. Indications. So why it is indicated? In whom it is indicated? In patients who are having pneumonia, bronchitis, COPD, cystic fibrosis, post-operative patients, and also patients who are on prolonged bed rest. So CPT is commonly used in patients with respiratory diseases. So it is also important after surgery when the patient cannot cough effectively. We have to keep in mind that what is wrong in the patient and we have to keep checking and following him up. Moving on to the contraindications. So CPT should not be performed in patients with rib fractures or unstable heart conditions, severe osteoporosis cases, pulmonary embolism and increased intracranial pressure patients. So always assess the patient before the procedure. What are the components of chest physiotherapy? Mainly, it is of postural drainage, percussion, vibration, deep breathing exercises, and coughing techniques. So we'll discuss about each one in detail. Postural drainage. So as you see the picture here, so all these are the positions which is given to drain the secretions out. So positioning patient to drain secretions uses gravity and different positions for different lung segments as you see here. Okay, so postural drainage, the patient is positioned so the gravity helps to drain mucus from the specific lung segments. Moving on to percussion. So percussion is nothing but a rhythmic clapping on the chest wall. So chest percussion mainly loosens the mucus through the rhythmic clapping on the chest wall with cupped hands. The hand must be cupped. So it helps loose the thick mucus so it can be coughed out. Moving on to vibration. Vibration enhances mucus clearance with gentle oscillations there. So gentle shaking. Okay, vibration is performed during the exhalation by applying the gentle pressure and shaking movements to move the secretions towards the larger airways. A gentle vibration with your palm is given so that the secretions will be moved to the larger airways. That is vibration. Moving on to breathing exercise. So it is of deep breathing, diaphragmatic breathing and incentive spirometry. Breathing exercises improves the lung expansion. Incentive spirometry is very commonly used after the surgery to prevent the lung collapse. So, coughing techniques. When the coughing techniques, effective coughing techniques such as huff cough and controlled coughing help move the mucus from the lungs while saving energy and preventing collapse. These methods involve sitting upright. How do we have to do this? By sitting upright, taking slow deep breaths, holding them and then exhaling forcefully with an open mouth to clear the phlegm rather than a sharp uncontrolled hacking. So this is controlled coughing. Then this is huff cough. So what is nurse's responsibility? So as nurses, we must assess the breath sounds and oxygen levels before and after the procedure. So assess the respiratory status, monitor the oxygen saturation, explain procedure to the patient, ensure the privacy, then perform before meals, not after meals. Encourage coughing after CPT. CPT should be done. Why it is to be done before meals? To prevent vomiting. So these are the things which we have to keep in mind while we are giving chest physiotherapy. Complications. So what are the complications? Monitor the patient closely during CPT. Stop the procedure if the patient develops breathing difficulty or chest pain. So hypoxia, vomiting, rib injury or bronchospasm are the complications. When you observe one of these, closely monitor the patient. Conclusion. To conclude, the physiotherapy is a simple but effective nursing intervention that improves the respiratory health. So it clears the secretions, prevents the lung complications. It includes postural drainage, percussion and vibration, and also huff cough techniques. So the nurses plays a key role in monitoring the patient and maintaining the health status of the patient. Hope you understood the topic. Thank you for listening. Thank you.